High blood pressure is the number one risk factor for death globally, and not just America. So high blood pressure, we link that to high salt intake, high sodium. And the average American consumes about, I think it's 7 grams of sodium a day. And we think like, oh my gosh, that's really high, because shouldn't it be around 1,500, 2,500, da 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 da. But if we go back in time before refrigeration, and because we preserved food in salt, the average consumption is supposed to be more like 15 grams per day. So if people were having like 15 grams of sodium a day, didn't they all have high blood pressure? And maybe a lot of them did. But the reason being, the kidneys are really great at getting rid of excess sodium. Very good at it. However, there's one thing that inhibits kidneys being able to do that, and that is insulin resistance, a condition we're seeing more and more of, and a condition that I talk about in the Mastering with Life program that's coming up in a couple of weeks, June 11th. So insulin resistance will actually inhibit the kidneys from excreting excess sodium. But how else can we bring blood pressure down? So we always think of the connection with sodium, but there's also a very, very strong connection with sugar. And somebody that's got a high sugar load in their diet, if they reduce their sugar intake, their blood pressure can drop rather rapidly. Well, we look at carbs, we look at protein, we look at all this, but let's really look at the devil in the work, right? And that's processed food. So processed food is generally high in both sugar and salt. So reducing processed food, not necessarily following a diet or a way of eating, but just removing processed food, can greatly reduce the impact of food on a person's blood pressure. So insulin resistance. This is a topic that I talk about in the Mastering with Life program, which is coming up in a couple of weeks, June 11th. I'm actually with my family in England right now, but when I get back, we will be ready to get started on that program. And I just wanted to give you a little bit of an example of how I coach. The program it's a weight loss coach, it's a body composition coach, but in the midlife program, we talk about insulin resistance and its role with regards to body composition, but we also go and talking about creating optimal health, because in midlife, it is going to be very problematic to change your body composition if you don't put your health first. So when we're younger and when we're kids, we can kind of pull all-nighters and eat not that good and just exercise ourselves into shape, and we can change our body composition, or we used to be able to change our body composition even if our health or lifestyles weren't the best. In midlife and beyond, that's not going to happen. We change our body composition by looking after our health, and that's what the Mastering with Life program is about. Anyway, June the 11th, link in bio, midlife month. I haven't coached this program for 10 months, and it might be another 10 months before it comes back, so don't miss it.